Welcome to MIHIRA'S English Listening Test for Healthcare Professionals. Sample Test 5. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a general practitioner talking to a patient called MIHIRA. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, MIHIRA. I'm Dr. Mitchell. How may I assist you today?
Good morning, Dr. Mitchell. I've been experiencing some rather perplexing symptoms lately, and I wanted to get them checked.
Certainly, MIHIRA. Could you please tell me the nature of these symptoms?
Well, doctor, I've been grappling with an extraordinary sense of fatigue, and my musculature appears to be exhibiting a state of weakness that has persisted for a few weeks now.
I see. Could you describe these symptoms further? Are there specific regions where you feel weakness, or MIHIRA, is it a pervasive sense of fatigue?
Primarily in my lower extremities, and at times my upper limbs show a considerable degree of heftiness. But now it's affecting even my face. I've also noted a certain dysphagia.
I see. MIHIRA, can you tell me more about this weakness? Does it come and go, or is it constant?
Activity triggers intensification of the weakness, which partially subsides with rest but never fully remits.
Have you experienced any other symptoms, MIHIRA, along with the weakness?
Well, yes, actually. My vision gets blurry sometimes, and I have difficulty swallowing occasionally. Also, my hands feel clumsy, and I've noticed trouble with balance.
Interesting. Have you tried anything to alleviate these symptoms, MIHIRA?
I've been taking painkillers, but they don't really help. I tried some over-the-counter muscle relaxants too, but no improvement.
Now, MIHIRA, have you had any other health concerns in the past? Any significant illnesses or surgeries?
Not really, doctor. I'm generally healthy. I did have bronchitis a few years ago, but that cleared up completely.
And what medications are you currently taking, MIHIRA, apart from the painkillers you mentioned?
Just some blood pressure medication, lisinopril.
Okay. Do you work, MIHIRA? What kind of activities do you typically do?
I work as a construction supervisor. My role necessitates a high degree of physical activity. Recently, however, the demands of the job have become increasingly taxing.
Any known allergies, MIHIRA, to medications or foods?
No, not that I'm aware of.
I see. MIHIRA, your symptoms and their presentation raise some concerns. To get a clearer picture, I'd recommend a test called a single-fiber electromyography, or SFEMG. It's a specialized test that helps diagnose neuromuscular junction disorders.
A neuromuscular junction disorder? What does that mean?
MIHIRA, it refers to a problem with the communication between your nerves and muscles. SFEMG can specifically assess the release of a neurotransmitter called acetylcholine, which plays a crucial role in muscle movement. Imagine your nerves like wires sending signals to your muscles, and the neuromuscular junction is like the plug that connects them. MIHIRA, when there's a problem with the junction, the signals don't get through properly, leading to muscle weakness.
I see. That sounds serious.
It can be, MIHIRA, but there are different types of neuromuscular junction disorders, and some are more treatable than others. SFEMG can help us identify the specific type you might have. One possibility is Lambert-Eaton myasthenic syndrome, LEMS, an autoimmune condition where the immune system mistakenly attacks the neuromuscular junction.
What? That's quite a mouthful. Anyway, if you think it's necessary, I'm willing to do the test. I just want to get to the bottom of this and hopefully find some relief.
Absolutely, MIHIRA. I'll get the referral in order and we'll discuss the details and next steps after the test results are available. In the meantime, continue resting and avoiding strenuous activities.
Thank you, Dr. Mitchell. I appreciate you taking the time to explain everything to me.
Extract 2. Questions 13 to 24. You hear a neurologist talking to a patient called MIHIRA. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, MIHIRA. Please, have a seat. It's good to see you again.
Good morning, Dr. Gilbert. Thank you for seeing me.
So, MIHIRA, how have you been feeling since our last appointment, 3 months ago?
Honestly, not much has changed. The fatigue is still there, especially in the afternoons. And sometimes, the tingling in my right hand gets pretty bad.
I see. Have you noticed any other changes in your symptoms? Any new problems, MIHIRA?
Well, maybe. My coordination hasn't been as good lately. I tripped while walking the dog a couple of days ago, which never used to happen.
That's concerning. MIHIRA, have you been following your treatment plan as we discussed?
Yes, I try to do the physiotherapy exercises every day. It's not always easy, but I'm doing my best.
I understand, MIHIRA. Now, let's talk about your medication adherence. Have you been taking your disease-modifying therapy as prescribed?
Yes, Dr. Gilbert. I'm very committed to my treatment plan. I know how important it is to stay consistent in managing the progression of my MS.
That's good to hear, MIHIRA. Adherence to your treatment plan is crucial in managing multiple sclerosis. Have there been any other medical issues you've encountered since our last meeting?
Not really, Dr. Gilbert. Just the usual fatigue and occasional dizziness, which I assume are related to the MS. And it's harder to stay active sometimes.
Right. Now, let's talk about lifestyle modifications. MIHIRA, have you made any changes to your diet or exercise routine?
I've been trying to eat healthier, but with work and family, it's tough. Exercise is difficult with the fatigue, but I try to go for short walks when I can.
I understand. We can look at ways to make adjustments that fit your schedule better. MIHIRA, are there any other issues you'd like to discuss today? Anything that's been bothering you?
Honestly, Dr. Gilbert, I'm worried about the future. This disease is unpredictable, and sometimes I feel like I'm losing control.
It's natural to feel that way, MIHIRA. Given the persistence of your fatigue and some lingering symptoms, I recommend further testing. How do you feel about it?
I understand your suggestion, Dr. Gilbert. If we can monitor things closely, why not?
This condition can be challenging, but MIHIRA, with proper management and support, you can lead a fulfilling life. I want to recommend a spinal MRI with gadolinium enhancement to get a more detailed picture of your central nervous system activity. To get a better understanding of your individual case and potential treatment options, MIHIRA, I'd like to recommend a lumbar puncture. It's a minimally invasive procedure that helps analyze cerebrospinal fluid. These can provide valuable insights into your MS activity.
Okay, I understand. Can we schedule those soon?
Absolutely, MIHIRA. My assistant will get you an appointment before you leave today. Remember, managing MS is a continuous process, and we'll work together to adjust your treatment plan as needed. I'm confident we can optimize your well-being and control the progression of your disease.
Thank you so much, Dr. Gilbert. I truly appreciate your support and guidance.
That is the end of Part A. Now, look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now, look at question 25. Question 25. You hear a morning briefing in a hospital ward. Now, read the question. Good morning, team. As we commence another day in our esteemed hospital ward, it's crucial to address a concerning trend that has come to our attention. There has been a noticeable increase in the number of unnecessary breaks taken during duty hours. While breaks are essential for maintaining well-being, excessive and untimely breaks can have severe consequences on patient care and overall efficiency. Firstly, let's acknowledge that our profession demands immense dedication and responsibility. Patients rely on us for their well-being, and any lapse in our commitment can lead to adverse outcomes. The extended breaks some of us have been taking can result in delayed responses to patient needs, impacting the quality of care we provide. Furthermore, it has come to our notice that some team members are not adhering to the designated break areas and are instead choosing locations that are not easily accessible in case of emergencies. This compromises our ability to respond promptly to critical situations. Please ensure that breaks are taken in the designated areas to maintain a streamlined workflow and ensure a swift response to any urgent situations that may arise. Additionally, we must address the issue of breaks being taken simultaneously by multiple team members. This can leave the ward short-staffed and put undue pressure on the remaining staff. We need to be mindful of our duty to our patients and colleagues by staggering break times and ensuring that adequate coverage is maintained at all times. Question 26. You hear a discussion between an anesthesiologist and a nurse. Now, read the question.
Good day, MIHIRA. Today, let's delve into the intricate procedure of lumbar puncture, an essential diagnostic and therapeutic technique that anesthesiologists occasionally perform. Understanding the nuances of this procedure is crucial for your role as a nurse, as it involves collaboration between different medical professionals. A lumbar puncture, commonly known as a spinal tap, is a medical procedure involving the insertion of a needle into the subarachnoid space in the lumbar region of the spine. The primary purpose is to obtain cerebrospinal fluid, CSF, for diagnostic testing or to administer medications directly to the cerebrospinal fluid. Before we proceed, it's crucial to comprehend the anatomy involved. The lumbar spine, located in the lower back, is chosen for its accessibility and reduced risk of spinal cord injury during the procedure. The subarachnoid space, where the needle is inserted, contains cerebrospinal fluid, which serves as a protective cushion for the brain and spinal cord. MIHIRA, let's discuss the procedure itself. The patient is positioned in a flexed posture, usually in a fetal position or seated and leaning forward. This positioning widens the spaces between the spinal vertebrae, making it easier to access the subarachnoid space. Sterility is of utmost importance during the procedure to minimize the risk of infection. MIHIRA, as an anesthesiologist, I play a crucial role in ensuring the patient's comfort and safety during the lumbar puncture. This involves administering local anesthesia to numb the skin and deeper tissues, making the procedure less painful. Additionally, I monitor vital signs closely to identify any adverse reactions promptly.
Question 27. You hear a conversation between a general practitioner and a nurse MIHIRA about a patient. Now, read the question.
Good morning, MIHIRA. I wanted to discuss the case of Mr. Johnson, who presents with some intriguing symptoms that have raised our suspicion of Lambert-Eaton myasthenic syndrome, LEMS. Have you had a chance to review his chart?
Yes, Dr. Johnson. I've gone through the notes. His reported muscle weakness, especially in the limbs, caught my attention. Also, the fluctuations in his symptoms throughout the day are quite unusual.
Absolutely, MIHIRA. Those fluctuations are characteristic of LEMS. It's associated with autoimmune dysfunction affecting neuromuscular transmission. I'm considering ordering an electromyography test for him. It will help us assess the electrical activity of his muscles and confirm our suspicion.
Interesting. I remember reading about the relationship between LEMS and small cell lung cancer. Should we consider a chest CT scan to rule out any malignancies?
You're right on track, MIHIRA. LEMS is often paraneoplastic, and an underlying malignancy, usually small cell lung cancer, is found in a significant number of cases. We'll include a chest CT scan in our diagnostic workup. However, bear in mind that not all LEMS cases are associated with cancer.
Got it, Dr. Johnson. I'll coordinate with the imaging department for the CT scan. Meanwhile, should we discuss potential treatment options with the patient?
Good thinking, MIHIRA. Treatment involves addressing the underlying malignancy if present and symptomatic management of the neuromuscular symptoms. Medications like 3,4-diaminopyridine and immunosuppressants are often considered. We'll need to closely monitor the patient's response to tailor the treatment plan.
It's fascinating how complex these cases can be. I'll ensure Mr. Johnson is well informed about the diagnostic procedures and potential treatments.
Question 28. You hear a conversation between a neurologist and a nurse MIHIRA about multiple sclerosis. Now, read the question.
MIHIRA, the hallmark of MS is its unpredictable nature and the involvement of multiple neurological functions. Ms. Anderson's symptoms align with this variability. We're planning an MRI to examine her brain and spinal cord for characteristic lesions associated with MS.
I read that MS has different subtypes. Could the specific subtype influence the treatment plan?
Excellent observation, MIHIRA. Indeed, the subtype of MS does play a role in determining the treatment approach. For instance, if it's relapsing-remitting MS, we might consider disease-modifying therapies to reduce the frequency and severity of relapses. However, in progressive forms, the focus is often on symptom management and maintaining the patient's quality of life.
That makes sense, Dr. Rodriguez. Are there specific tests to definitively diagnose MS, or is it mainly based on clinical and imaging findings?
You're thinking in the right direction, MIHIRA. While there is no single test to confirm MS definitively, a combination of clinical evaluation, imaging studies like MRI, and sometimes cerebrospinal fluid analysis can support the diagnosis. It's crucial to rule out other conditions that may mimic MS symptoms.
I'll make sure to coordinate the necessary tests for Ms. Anderson. How about involving her in decision-making regarding her treatment plan?
Absolutely, MIHIRA. In MS management, patient involvement is key. We need to discuss the potential benefits and risks of various treatments, taking into account her preferences and lifestyle.
Question 29. You hear a presentation by a professor on single-fiber electromyography. Now, read the question.
Now,
Imagine the neuromuscular junction as a bustling intersection where nerves communicate with muscles. In traditional electromyography, we get a broad overview, much like observing traffic from a distance. SFEMG, on the other hand, is like having a microscope to scrutinize individual vehicles, or, in this case, muscle fibers, as they receive signals from nerves. The process involves inserting a fine needle electrode into a single muscle fiber, allowing us to examine the electrical activity at the neuromuscular junction. It's like eavesdropping on the conversation between nerves and muscles, gaining insights into the efficiency of this crucial communication. Why does this matter? Well, consider it as looking for glitches in a phone call. SFEMG helps us identify subtle abnormalities in neuromuscular transmission that may go unnoticed in standard electromyography. This level of precision is particularly useful in diagnosing disorders such as myasthenia gravis, Lambert-Eaton myasthenic syndrome, and other neuromuscular junction disorders.
Question 30. You hear a pharmacist describing over-the-counter muscle relaxants. Now, read the question.
Greetings everyone. Today, let's unravel the intriguing world of over-the-counter, OTC, muscle relaxants. Picture this, your muscles are the unsung heroes, constantly working to keep you moving. But sometimes, they protest with tension and discomfort. That's where muscle relaxants come into play, the unsung heroes of relief. Now, OTC muscle relaxants are like the superheroes in the pharmacy aisle, ready to tackle muscle spasms and tension without the need for a prescription. These medications work by influencing the central nervous system, easing the messages sent between the nerves and muscles. It's akin to giving your muscles a pep talk, convincing them to loosen up and take a break. It's essential to note that OTC muscle relaxants come in various forms: pills, liquids, or topical creams. Each has its own unique way of delivering relief. The oral formulations, for instance, spread their magic throughout the entire body, providing comprehensive relief. On the other hand, topical creams target specific areas, offering a more localized solution.
That is the end of Part B. Now, look at Part C. Part C. In this part of the test, you hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now, look at Extract 1. Extract 1, questions 31 to 36. You hear an interview between Dr. MIHIRAA and an interviewer on the MIHIRA'S experience in treating Lambert-Eaton myasthenic syndrome. You now have 90 seconds to read questions 31 to 36.
Dr. MIHIRA, your dedication to understanding and treating Lambert-Eaton myasthenic syndrome, LEMS, over the decades is truly commendable. Could you elaborate for our audience, in layman's terms, on the intricacies of this rare condition and how it manifests in individuals?
Absolutely. Lambert-Eaton myasthenic syndrome, or LEMS, is a captivating yet intricate neuromuscular disorder. To comprehend it better, let's envision the body's communication system, which is responsible for signaling muscles to move. Now, picture this system experiencing disruption. In the case of LEMS, an autoimmune response occurs where the body mistakenly attacks the presynaptic junction. This junction is a tiny but crucial gateway where nerves release chemicals to activate muscles. This autoimmune attack on the presynaptic junction results in a breakdown of effective communication between nerves and muscles. Consequently, individuals with LEMS experience muscle weakness, primarily affecting the legs, arms, and throat. The challenges lie in the fact that these weakened muscles can impact various aspects of daily life, from basic movements to more complex tasks, leading to a range of symptoms that significantly affect the quality of life for those with LEMS.
Dr. MIHIRA, delving deeper into Lambert-Eaton myasthenic syndrome, LEMS, could you provide more insight into the different types of LEMS that exist? It's intriguing to understand the nuances and variations within this condition.
Certainly. LEMS presents itself in different forms, with the most common being paraneoplastic LEMS. This type is intricately linked to certain cancers, particularly lung or small cell tumors. The autoimmune response in paraneoplastic LEMS is often triggered by the presence of these malignancies. It adds a layer of complexity to the condition, as effectively managing LEMS involves addressing both the neuromuscular challenges and the underlying cancer. On the other hand, there's the idiopathic form of LEMS, where the cause remains a mystery. This particular subtype poses a unique challenge for clinicians as the triggers leading to the autoimmune response are not readily identifiable. Despite the unknown origin, idiopathic LEMS shares similar symptoms with its paraneoplastic counterpart, such as muscle weakness and difficulty in coordination. Understanding these distinct types of LEMS is crucial because the underlying triggers influence the course of the condition and guide tailored treatment approaches. By unraveling the complexities of each subtype, we can better comprehend the diverse manifestations of LEMS and refine our strategies for providing optimal care to affected individuals.
Dr. MIHIRA, moving to the personal aspect of your work, could you share a poignant story that encapsulates the challenges and triumphs of treating Lambert-Eaton myasthenic syndrome, LEMS?
Absolutely. One patient, Sarah, comes to mind. She was diagnosed with paraneoplastic LEMS, and her journey was emblematic of the intricate nature of this condition. Sarah's muscle weakness was pervasive, making even the simplest tasks, like walking or lifting a cup, overwhelming for her. Our approach involved not only addressing the LEMS symptoms but also treating the underlying cancer, a critical aspect of paraneoplastic LEMS. The road to recovery for Sarah was long and arduous, marked by various treatments and therapies. However, witnessing her gradual resurgence and regaining of strength, step by step, was truly gratifying. Sarah's story highlights the resilience of individuals facing LEMS and the comprehensive approach required to navigate the challenges posed by both the neuromuscular disorder and its underlying triggers.
Absolutely. Dr. MIHIRA, in the realm of long-term care for Lambert-Eaton myasthenic syndrome, LEMS, could you share insights into your experience with recurring patients? Do you encounter individuals who grapple with LEMS over extended periods?
Absolutely. Managing LEMS frequently involves a commitment to long-term care. Take Mr. David, for instance. He has been living with this condition for over a decade. Our journey together has been marked by adapting and fine-tuning his treatment regimen to address the evolving nature of his symptoms. It's a dynamic process that involves close monitoring and adjustments to ensure he not only copes with the challenges of LEMS but also maintains a good quality of life. The extended duration of Mr. David's battle with LEMS emphasizes the chronic nature of this neuromuscular disorder and the importance of personalized, adaptive care plans that consider the long-term well-being of individuals facing the complexities of LEMS.
Dr. MIHIRA, it's fascinating to hear about your patients' journeys. Can you elaborate on the potential for complete remission in Lambert-Eaton myasthenic syndrome (LEMS)? Are there instances where individuals have been entirely cured of the condition?
Indeed, while complete remission in LEMS is relatively uncommon, it is not unheard of. Allow me to share the story of one of my earliest patients, Mr. William. Diagnosed 35 years ago, he diligently adhered to his treatment plan, and over time, his LEMS entered into complete remission. Witnessing such a remarkable outcome is truly gratifying and serves as a testament to the effectiveness of tailored treatment approaches. Mr. Williams' case underscores the importance of early diagnosis, consistent adherence to treatment protocols, and the potential for positive long-term outcomes in managing LEMS. While each case is unique, these instances of complete remission offer hope and inspiration to both patients and healthcare professionals alike.
Dr. MIHIRA, it's enlightening to consider the holistic approach to LEMS management. Beyond medical interventions, do social factors play a role in effectively navigating this condition?
Indeed, they do. Lambert-Eaton myasthenic syndrome, LEMS, can have profound effects on a person's social life and self-esteem. Recognizing the importance of social support is integral to comprehensive care. Understanding and encouragement from family and friends play a pivotal role in an individual's journey with LEMS. It's not just about the physical aspect of the condition, the emotional well-being of patients is equally crucial. I often emphasize the significance of staying connected with loved ones and engaging in activities that bring joy and fulfillment. This approach not only contributes to a more robust support system but also positively influences emotional resilience and treatment adherence. Acknowledging and addressing the social dimensions of LEMS management is essential for fostering a holistic and patient-centered approach to care.
Well, Dr. MIHIRA, your insights shed light on the complexities and triumphs of living with LEMS. Thank you for sharing your knowledge and experiences.
It's my pleasure. Remember, while LEMS presents challenges, with proper diagnosis, treatment, and support, individuals can lead fulfilling lives. LEMS awareness and understanding are crucial in this journey, and I hope our conversation today contributes to that.
Extract 2. Now, look at Extract 2. Extract 2, questions 37 to 42. You hear a neurologist, Edward Hermath, talking on research on multiple sclerosis at MIHIRA Research Center. You now have 90 seconds to read questions 37 to 42.
distinguished guests, esteemed colleagues, and fellow enthusiasts of the enigmatic world of the human brain, I stand before you today to delve into the complexities of a disease that continues to perplex us, multiple sclerosis, MS. My name is Dr. Edward Hermath, a neurologist at MIHIRA Research Center, and I dedicate my days to untangling the intricate web of MS, one axon at a time. Let's demystifying the maze. What is multiple sclerosis? Imagine your brain as a bustling metropolis, teeming with neural highways carrying the vital cargo of information. In MS, this meticulously constructed network is waylaid by an unwelcome visitor, the immune system. Mistaking myelin, the fatty sheath insulating our axons, for a foreign invader, the immune system launches a relentless assault. This inflammatory onslaught disrupts the smooth flow of communication, leading to a cascade of unpredictable symptoms, from tingling and numbness to debilitating fatigue and vision problems. Now, through the doctor's looking glass, a view from the trenches. As a neurologist, I witness firsthand the devastating impact of MS. The frustration in a young mother's eyes as she struggles to grasp a sippy cup, the despair etched on a father's face as he watches his child stumble, the quiet resignation in a veteran's voice as he describes his fading vision, these are the poignant realities of MS. Yet, amidst the shadows, there flickers a tenacious spirit, a quiet heroism in the face of adversity. It is this unwavering resilience that fuels my research, that compels me to decipher the cryptic code of MS. Next, unearthing the gems, research sampling and its significance. Imagine sifting through a mountain of sand, meticulously searching for a single, shimmering diamond. This is the essence of research sampling, identifying a representative subset from a larger population to glean meaningful insights. In MS research, this translates to carefully selecting study participants who reflect the diverse tapestry of the disease. Why is this crucial? Because MS, like a mischievous chameleon, dons different masks for different individuals. Understanding this heterogeneity is the key to unlocking the secrets of effective treatment. The art of healing, how treatment shapes the MS landscape. Treatment for MS is a delicate dance, a constant negotiation between dampening the overactive immune system and minimizing the collateral damage. We have a diverse armamentarium at our disposal: immunomodulatory drugs, corticosteroids, and even hematopoietic stem cell transplantation, each wielding its own unique weapon against the MS beast. But the choice is never straightforward. We must carefully weigh the potential benefits against the risks, tailoring our approach to the individual's unique needs and disease course. A stitch in time saves 9. Why early intervention matters. MS is a cunning adversary, one that thrives in the shadows. Early diagnosis and intervention are not just desirable, they are imperative. By intervening early, we can potentially prevent the inflammatory storms from wreaking havoc on the delicate neural network. This is not about achieving a mythical cure, but about buying time, preserving function, and empowering individuals to lead fulfilling lives. Lastly, the verdict is in unveiling the research findings. Our research at MIHIRA has yielded promising results. We have identified novel therapeutic targets, explored the potential of personalized medicine approaches, and gained valuable insights into the complex interplay between genetics and environment in MS. While there is no magic bullet, and no one-size-fits-all solution, our findings pave the way for the development of more effective, targeted therapies.
That is the end of Part C. Now check the answers.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.